Shalom, this is Graciela Reyes Salinas, and today we're going to be talking about SCDs, or sequential compression devices. Also, they are known as pneumatic compression devices. So what this machine is used at the bedside. As you see it here in the picture, is hanging from the footboard in the bed. So it's hanging there. The patient is over in bed. So it has this hose that will connect to the actual hoses or dead hoses, and you will see it in a minute. Now it's very simple right now. When I started working in nursing in the United States, the machines were a lot more complicated. Now they're awesome, they're automatic. They do a lot more than the ones we used to use, and they're automatic, like I said. So all you have to do is turn the button on, and it will run a check. By then, you have to have put the sleeves on the patient on both legs. So you will have button A and side B, which will represent each one of the legs. Of course, there may be times that a patient only has one leg, so then you will only be connecting one, and that's okay, it can happen. In this area here is for the monitoring, so it will monitor how much pressure to give, how long to give it, and all that is automatic. Like I said before, we have to set up the pressure and the length. You will have to probably take it off the patient once a shift so they can rest, because usually they are worn along with the TED hoses. And I'll tell you what a TED hose is in a little bit. But let's see how it looks, how the sleeves look like in here. So here we are. This is a picture of the sleeves. So you will wrap each one of them to be snuggled on each one of the legs. And of course, then you will connect the hoses to the machine. So what this will do is that it will compress on a sequential mode, and that's why it's called sequential compression device, because it's sequential. It starts at the bottom and it presses so that it will pump the blood to return back to the heart. It'll do it, I think it's about a minute that it holds it, and then it moves to the next level. So again, is pushing the blood up, mimicking the movement when we are walking, for example. So who will use this type of machine? Anyone who has a significant change in level of activity. For example, somebody who just had an accident and is probably unconscious or won't be able to walk for a few days, then they will need to wear this to prevent deep vein thrombosis, or actually VTE, venous thromboembolism. The venous thromboembolism is a little bit more superficial. Deep vein thrombosis obviously is deeper, so it will go from VTE to DVT, and the worst complication is pulmonary emboli, which is what you want to avoid. And so how does a thrombus or a deep vein thrombosis develop? There has to be several things. One of them is stasis. So when the patient doesn't move, it's at high risk for developing DVT. If on top of that, the patient has issues with coagulation, if there has been injury to the vessels, whether it's because of an accident, like I said, or because any kind of fracture or problems, maybe even starting an IV, which is rare because we rarely start an IV on the bottom, but even an injury that is done by a needle can provoke a DVT. Now, the other thing that I was going to tell you, let me show you better how it works. As you can see, it's circular. So, but it compresses one area and then moves to the next and compresses it, and then to the next and compresses it. Some of these sleeves are knee-high, so they only go to here. And as you can see, these are thigh-high. a little bit higher. And this is because the patient won't be able to move at all. A stroke patient, like I said, somebody with an accident, a spinal cord injury patient, a patient who's going to have surgery and is going to have to stay in bed for a few days. All of them are candidates to having sequential compression device, or SCD. And you will have to put it on and turn it on. So here is the inside of the sleeve. Like I was saying, first it will pump to the bottom, the section 1, if you may. Once it pumps and it knows that the next level has been filled, it stays pump, and then the next one pumps so that the blood will be pushed to the third area. And then supposedly once it gets to the area that doesn't pump, it cannot come back because it's pumping here. So it's forcing the blood to move forward toward the heart. Usually it is used with TED hoses, TED, thromboembolism deterrent, TED hoses. These are like, just think about your pantyhose. They're hose, but they're not pantyhose, it's just hose. So it could be thigh high, it could be knee high. They are the most difficult things to put on because they're elastic, like elastic stockinette. And so we have to put them on. And then, like I said, at least once a day, sometimes the doctor will ask for more than once a day, we have to take it off. Of course, to give the patient a bath, but also to let them rest for a little bit. And then we have to put it on, and like I said, it's so difficult to put it back on. So most commonly they have open toe. Some of them have it in such a way that you can kind of, the toes can be open, or you can like pull the sleeve over the toes to cover them just in case the patient is cold. But if you need to do assessment, usually they're gonna be uncovered, or you have to have access to those toes. Then you can uncover and do your assessment of your breast capillary refill, circulation, temperature, etc. And then if you need to, you can cover those toes again without having to take off and put on the entire stocking. So that's what this is. Again, it's a sequential compression device and is used commonly with a TED hose. I hope that you are learning some about these machines, and I hope that you are also enjoying to think when you're coming to the United States. Have a blessed night.